Care coordination presentation to colleagues video. Andrew Williams, Capella University, Nurses Flex Program 4050, Coordinating Patient-Centered Care, Dr. Iris, June 2022. Hello nurses, and thank to everyone for taking the time to be here for this presentation. My name is Andrew Williams, and I am currently working on the care coordination for some of the patients that come to our clinics. As you know, the care coordinators have been reassigned to inpatient duties due to staffing challenges. Therefore, our clinic needs to make some adjustments to maintain the high standard of care and to achieve the best outcomes. We are challenged with taking on care coordination responsibility for our patients. I have been asked to share with you the basics of care coordination. We will be covering the strategies to engage patients and family in care coordination process to acquire health outcome, identify the aspects of change management that affects the patient experience essential to the provision of high quality care. We'll also be covering rationales for care coordination plans based on ethical decision making, and we'll identify the potential impact of specific health care policies, provisions on outcome and patient experience. But before we start, let's talk about the change process you are being asked to participate in and the change management approach. Some nurses may be upset or even angry that we are implementing these interventions. I assure you that those feelings are acknowledged. This presentation is designed to share with you why the change is necessary, the goals and benefits of the change, and to earn your commitment to establishing the change process. I imagine that some nurses may fear the potential impact of the change and have concerns or questions about how their roles might be affected. This presentation will address those concerns, and your supervisors are available to answer any questions you have outside of these presentations. Things will not start off smoothly, so as the new process is adapted and the glitches emerge, you will have the opportunity for training and time to learn the process. These are our patients, and they depend on us to be their liaisons, to be their advocates, their educators and guides. This is our clinic, and our care reflects on us. Let us hone these challenges and show our patients how special they are. Okay, so let's get into this. What is care coordination? The general description of care coordination is the deliberate construction of patient-centered care activities with a collaborative team approach to navigate the healthcare system for optimal patient care outcome and save on the cost of care. Agency for Healthcare Research and Quality, AHRQ, and D. The care coordinator role is to marshal the delivery of patient care by synchronizing all the patient interactions with multiple providers and specialists to eliminate waste and duplicate care. Care coordination aims to facilitate the patient health needs and preference with clear communication and deliberate organization to enable the smooth transition between providers. Okunobi et al. 2017. Care coordination eliminates redundancies, minimize ER visits and hospitalization, optimize initiatives for visits with specialists, and optimize chronic disease management. Care coordination focuses on each patient's total health needs from a holistic perspective, including their psychosocial, cultural, ethical, and physiological, and even their perceived health severity. Coram L. Hat 2021. Evidence has shown that nurses are well positioned to deliver the best results from care coordination regardless of the situation. American Academy of Ambulatory Care Nurses, AAACN 2017. Effective communication and care transition are necessary to boost the efficiency of care coordination. Here in primary care clinic, we can utilize the approach of a guided care model that has been shown to decrease healthcare costs by 11% for providers and an annual saving of $1,364 per patient for healthcare insurers. NEJM Catalyst 2018. Now let's look at the effective strategies for collaboration. Appropriate strategies are necessary to achieve patient engagement in planning and making decisions about their care. Patients involved in the process have better outcomes and are more likely to make better choices to manage their health. Aslinda et al. 2021. Good communication is a fundamental building block for effective care coordination. Porteous et al. 2021 found that the better the communication between patients, the care coordinator, and the care team, the higher the quality of care received. Care coordinators should also be mindful of cultural competency. Cultural competence is essential for delivering quality care, especially in our growing multicultural society. McGregor et al. 2019. The impact of cultural competency is illustrated in the NURS-FPX program 40/50 assessment for the Villa Health Culture Competency Activity. Surrounding the newly diagnosed diabetic patient, Emilio the nurse showed poor communication techniques, a lack of cultural competence, and violated the ethical principle of autonomy. Emilio failed to establish good communication with the patient because he did not take the time to listen or learn from the patient perspective what was most concerning to her. He then assumed that since the patient is Latino, she must love rice and bean. He was wrong, and even upset the patient due to poor cultural awareness. Emilio's ethical violation came from his lack of respect for the patient's right to autonomy in making decisions without judgment. On the other hand, Lucas, the diabetic educator, was very professional. He exercised the communication technique of listening attentively, acknowledged the patient's concern, and assured the patient that he was there to help answer the questions and concern. Lucas adhered to his ethical obligation by offering information to the patient and respecting the patient's autonomy to make decisions without judgment. He demonstrated cultural competency by not assuming his approach on his personal belief on stigma or assumption. He realized that even though the patient may be a Latino or of a specific ethnicity, it does not necessarily mean the patient likes or preference have anything to do with the ethnic group. Peruciti et al. 2021 suggests that patient self-management strategies is an impactful method of capturing patients' involvement in planning and decision essential to managing their health. Okunobi et al. 2017 co-sponsored the suggestion that the engagement of patients and families in their process has resulted in improved access to care, higher compliance with care plans, and fewer adverse incidents, and improved patient care outcome. Aspect of the change management. Patient nurses must acknowledge that change is inevitable and embrace as it is fundamental for growth and progression. If we didn't have change, we would not be practicing nursing the way we do today. Advancements in nurses have emerged because of a need for change. Hussein et al. 2018 proposed that Kurt Lewin three-step change theory adds dimension to care coordination. The three steps are unfreezing, change, and refreezing. Unfreezing is breaking down the patient's current situation into smaller, simpler blocks of information that are easier to manage. Changing is creating an action plan with step-by-step objectives, testing and evaluating those objectives, then refreezing by putting those objectives into full practice. Unfreezing step would obtain answers to questions that are holistic and cover financial, psychosocial, and cultural areas of the patient life. The change step would design objectives based on the SMART goal approach. And the refreezing steps would utilize the Better Health or Healthy People 2030 approach to implement the plan of care. Coordinated care plan based on an ethical dilemma. Nursing must stand by the principle of autonomy, beneficence, maleficence, and justice, as well as the American Nursing Association Code of Ethics. 9 provisions when coordinating care. This practice is vital to help nurses make the right decision that is ethical and right for the patient in situation with ethical questions or dilemma. Nurses Journal 2021. Some situations, such as the NURS-FPX program 50 assessment 3 activity about 2 patients needing dialysis with only 1 spot available, are prime examples of an ethical dilemma. In such a situation, the nurse needs to involve other team members to get more information on each patient and what they wish to do. The nurse will also need to look at another patient, if other patients can be rescheduled, or if another spot can be created by staying later to provide both dialysis, or what is necessary to resolve the dilemma. Next question. The impact of healthcare policy provision. The Affordable Care Act, signed into law by President Obama in 2010, has significant impact on healthcare. The original goal was for everyone to have access to affordable health insurance, to expand the Medicaid plan to include adults living 138% below the federal poverty line, and to improve the quality of care while reducing costs. Assistant Secretary of Public Affairs, ASPA 2021. The accountable care organizations and patient-centered medical homes have emerged because of these government provisions. They are designed to reduce cost and improve quality of care, with care coordination being the center. The recent New York State BSN in 10 law was established to increase the percentage of nurses with bachelor's degrees. The result is a better quality of care being provided because of higher education and competencies of the nurses. O'Brien et al. In 2018. HIPAA laws were put in place to protect patient private health information. HIPAA laws determine what information or protects information transferred electronically, called the security law, and the privacy HIPAA law is there to protect all information, whether transferred electronically, orally, or in writing. There are other laws, but we can discuss those when we get together. Nurses' roles are vital in care coordination. Nurses are in the best position to have the most effective impact on care coordination. Nurses are most in tune with the community because they are usually at the forefront of everything. Nurses' roles as educators, liaisons, advocates, and guides place them central to multiple aspects of healthcare. Nurses can compile and access various resources to coordinate care in the community. Care coordination can use Healthy People 2030 has a additional tool for community support in all areas of disparities. The care coordinators as the ethnic care coordinators has the ethnic maturity, cultural expertise, and educational background to provide the patient with the resources and access to optimal health care. In conclusion, I will close out this presentation by appealing to your spirit as one nurse to another. Step forward with me as we bring proper care coordination to our patient and help them to live their best lives. We covered the role of coordinators, effective strategies, aspects of change management, ethnic principles, government policies, and how you and I can pull all this together for our patients. I know this was a lot, but we are nurses, and that's what we do. Let us do this for our patients. Thank you. Enjoy the rest of your day.